Do you suffer from knee pain when you get up in the morning and have to take a few steps before you start to feel relief? If that's the case, this video is made exactly for you, because I'm going to teach you 5 techniques to improve blood flow, to eliminate all those inflammatory substances so your knee hurts less when you get up and you feel more ready to walk. And this applies both to those of you who have pain in the mornings when you get up, and to those people who sit for an hour and then, when you stand up, that same pain appears and gradually wears off with each step. First of all, have your knee uncovered. Imagine you're sitting on the edge of the bed. The first technique is a massage of the joint line. If we look at a knee from this angle, we'll see the different parts. Let's highlight the lower part, which is the tibia, forming the plateau where the femur rests, which is this upper bone we have here, and finally the patella, which is this round bone we have in front. You don't need to memorize it, just have a simple understanding of them, because the first massage basically focuses on the joint line, that is, the line that exists between the femur and the tibia. And for that, we're going to start by locating the patella, which is this circular bone that's practically in front of and above your knee. Remember, we're going to massage the joint line, and it's located between the femur and the tibia. Very good. Once we've located the patella, what we're going to do is use our fingers. You can use a little bit of oil if you want, but it's not absolutely necessary. Use your index and middle fingers and place them just below the patella. You'll be at the level of the patellar tendon. From here, what I want you to do is move those fingers outward and feel with your fingers how there's a groove between the upper bone, the femur, and the lower bone, the tibia. If your fingers are sensitive enough, you'll notice it. What we want is to work on that entire joint line, the whole joint, and we're going to do 5 to 10 presses simply in this direction. I place my fingers at the patellar tendon, pull outward, 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 until I reach the back, the lateral part of the knee. I push, press with my fingers, pull outward, and complete the technique. It's a pretty pleasant massage. You can do it 5, 10 times 3, as many times as you want. Basically, what we improve with this is the blood flow to the tissue and to the skin there. We bring more blood to the knee, and this helps us to remove those inflammatory substances that have accumulated during the night. That's basically why it goes away when you walk, because fresh blood flows in and removes all that buildup that causes pain. Once we've done this 5 or 10 times, you'll already notice your knee feels slightly different. Next, I want you to fully extend that knee, and now we're going to focus on the kneecap again. Remember, the kneecap is that small round bone that's right in front. See if you can spot it? There it is. And this bone has a special characteristic. It floats because it's not anchored. It doesn't have any joint with another bone through a joint capsule. It just floats. Below is the patellar tendon, above is the quadriceps tendon. So what I want is for you to take your index fingers from both hands and place them on both sides of your kneecap. Let your knee be completely relaxed, if possible, straightened, but without any muscle contraction, no muscle activity at all. And from here, that kneecap will be free and you can start to move it. Notice, the movement is not very exaggerated, it's just gentle. I would say I move the kneecap about 0.5 centimeter to each side, and this allows me to once again improve blood flow, joint tissue nourishment, and clear away waste products. Let me explain again. Keep your leg fully straight. I'm repeating because this technique is challenging. With your legs straight and resting on your heel at the edge of your bed, place an index finger on each side of your kneecap. Now try moving the kneecap from side to side. It's essential that the muscles in your leg, especially the quadriceps, the muscle at the front, are completely relaxed. Because if it's tense, the kneecap will get stuck and we won't be able to move it, okay? Notice the difference. Here I'm moving it. Here I have it contracted and I can't move it. We won't spend long, basically 30 seconds, moving that kneecap to each side. Once we've done that transverse axis from side to side, we're going to move on to a longitudinal axis, which is from top to bottom. I want you to place your index finger just below the kneecap, your thumb above it. As you can see, we're placing, remember, those fingers in the following way. Index finger below, thumb above. And this allows us to move the kneecap in this direction. Previously, what we did was move it sideways. Once you have that grip right, which might take you a little while to recognize and a little while to master, we're going to do movements up and down, up and down. Again, leg completely relaxed. Again, sideways. The leg also completely stretched out. How long? 15, 20, 30 seconds. You don't need more than that. Obviously, the first few times, since you've never touched your kneecap before, it's probably going to be a bit harder for you to master the movement. It's okay, alright? Once you master it, it will be very quick. Once we finish these massage and mobilization techniques, which will take you about a minute and a half, we're going to bring that knee back and place it on the ground again with your knee bent at 90 degrees. And from here, we're going to pivot on the heel. Pay close attention. It looks complicated, but it's not. I want you to point your toes inward as much as possible and then set the front of your foot back down. Again, it's a subtle, small movement. We lift, rotate, and lower. We try to focus the movement, especially here at the knee level. I don't want the knee to do this. I don't want it to do that. No, the knee stays still. I recommend placing a hand on it, and it's only the foot and the tibia that move. I lift, go outward, and let that foot drop. See? We've completed one repetition. I lift, go inward, and set it down. It might be a bit difficult the first few times, but it's easy to master. I lift, rotate, and go outward. I don't lift and bring the knee inward. I don't lift and bring the knee outward. This axis remains fixed and it's a rotation of the tibia. We do 2. Lift outward, down. 3. Lift inward, down. Lift, rotate. 4. Lift. Down. Last repetition. Up, close and down. Very good. We have pivoted on the heel, moving the forefoot. This also generates certain internal movements, again, at the knee level, which again increase blood flow and circulation and help reduce all that inflammation. We have pivoted on the heel because we were lifting the front of the foot. Now we're going to do the opposite. We're going to pivot on the front of the foot. Simpler than the previous one, honestly. We're going to lift the heel. I want you to move it outward and let it drop. And again, let's try to keep that knee from losing its alignment, from moving to the sides, okay? I lift my heel, turn it outward, then lower it. I lift the heel, pivot, move my heel inward and lower it. I lift the heel, pivot and lower it. Pivot movements to work on tibial rotation. Up, rotate and lower. I've done 3, let's do 2 more. Up, I pivot and lower. Up, I pivot and lower. 4, last repetition. Up, I pivot, lower. Up, I pivot and lower. Very good. I exaggerate the exercises quite a bit, okay? It's unlikely that you can replicate them perfectly at home. But it's important that if any of them cause you pain, especially these pivot ones, you set them aside and don't complete them. While these are exercises that can help you increase blood flow, depending on the condition of your knee, in some cases they could cause some discomfort. We've done some mobilization work, we've done some joint work with those rotations, and now we're going to do some muscle work. We're going to work on that quadriceps muscle that's located in the front of our leg and is essential for proper knee function. Please straighten your leg again and keep your heel on the ground. And from here, I want you to contract your quadriceps. Look, remember that kneecap that was here? We talked about it and how the quadriceps contracts and presses it down. Basically, it's the muscle that helps us extend the leg, okay? And when it contracts, it pulls on the kneecap and makes the leg lift up, okay? That's the muscle, all right? It significantly affects the kneecap, which acts as a lever arm in the movement. So I want you to put your hands, your fingers around your kneecap again, and this time press down, as if you wanted to crush the floor with your heel and the back of your knee, keeping your leg very, very straight. And also, we're going to bring your toes toward you. As you can see, the kneecap is very tight. It's impossible to move it. And that's, of course, a sign that you're doing the exercise correctly. Let's count. 1, 2, 3, 4, and 5. Relax your foot, relax your leg. Look, now the kneecap can be moved. Let's go with the second repetition. I press down with my heel, I press down with my knee. Very straight. Kneecap right here. Solid, steady. 1, 2, 3, 4, and 5, and relax. Very, very good. Let's go with the third one. Press down, toes toward me. Keep the contraction. 1, 2, 3, 4, and 5, relax. Last 2. Kneecap relaxed, leg without contraction. Again, push down, contraction. You saw there how that kneecap went up. 5 seconds. 2, 3, 4, 5, relax again. Everything relaxes, foot and knee. And let's go with the last one. Press down, toes toward me. Look closely at that kneecap, very steady. 1, 2, 3, 4, and 5. and relax. What do you think? Simple, right? Very good. Let's go with the last one. An exercise that will not only work at the knee level, but also a little at the hip level, because that muscle has a head that is biarticular. For that, basically you're going to position yourself like this. Grab your knee with your right arm, especially if you have lower back pain. Occasionally, we're going to bring your toes up just like before. This time, I want you to point it straight up toward the ceiling, and from here, I want you to lift your leg a few centimeters off the ground. You should feel that contraction right here in front of your thigh, and you'll see how your kneecap is held very tight. That means the exercise is being effective. Hold for a couple of seconds and lower it down. If you can't lift your leg, well, just the intention of lifting it or even raising it a little and letting it drop is already more than enough. Let me remind you, it's not about doing or not doing the exercise, but about finding a difficulty that suits your abilities. Pull your toes toward you. Let's lift. We keep that heel off the ground. We press and relax. Very good. Let's go again. Toes toward me. Keep the kneecap pressed down. Lift. 1, 2, 3, 5 if you can. If it's less, it's less. Relax. Let's do 2 more. Toes up. Lift. Relax. Very good. Last repetition. Toes up. Lift. And relax. Wow, we've done 5 repetitions. We use that initial massage technique at the joint line and patellar tendon level. That second technique of mobilizing the kneecap over the femur and tibia. Then we did a pivot movement on the heel. Next, a pivot movement on the ball of the foot. And finally, a muscle activation exercise, keeping the leg straight and lifting it. A complete set of exercises that will help you relieve that pain. In the mornings, I'm sure that if you get up now, you'll notice how your knee responds better, and that there's much less discomfort. Try it. Ideally, you should do about 5 repetitions of each technique. You don't need to spend a lot of time on it. Just 5 minutes focused on that knee will greatly improve the way you get up, and also the condition of that knee. It will make it more mobile, it will make it stronger. So don't hesitate to invest a little bit of time to improve your health, instead of taking so many medications. I hope you liked it. I hope you were able to do them at home while I was explaining, and I hope you can share this with all those people who need it, since I make my knowledge available to you, but it's you who brings physical therapy within everyone's reach. Before you go, you know I have a newsletter, a weekly email that I send every Sunday where I'll send you all the videos I've published during the week on YouTube. But not only that, every Sunday. You'll also get a link to access my library where I have more than 1,000 videos, and I'm sure you'll find one related to your condition. 1,000 videos organized by body area and condition. And not only that, but you'll also have priority access to all the events and program launches I do throughout the year. It's completely free. You just click up here in the top right corner of the screen, leave your email, and you're automatically in. The following Sunday, you'll receive the videos I've published during the week. That's all. I sincerely thank you for staying with me until the end, and I hope to see you again very soon in one of my other videos.